9th week of gestation. Congratulations, mom, your hormones are up there. There are people only now discovering that they are pregnant because they had bleeding from the nidation in the 4th week. Confused with menstruation and only now realize the menstrual delay and a lot of symptom. It's common to happen too. My first pregnancy was like that. Be very welcome, and if you want to know what happens to you with your body, with your baby, one more food tip and special tips to do this week. Stay with me and I will tell you. Hello, I am Monica Romero. I'm very happy to have you here with me. Congratulations, mom. 9th week passes flying is not the 9th week of pregnancy. It is also the beginning of the 3rd lunar month. As I said earlier, the lunar month has 4 closed weeks, different from our calendar. From our calendar, you'd be almost 2 months old. Actually, you'll be 2 months this week. If the date of your last menstrual period, for example, was January 1st or January, today for you would be February 26th, and this week runs until March 4th. So, to give you an idea of more or less how you would be counting month by month, I help you do this calculation every month. Don't worry. Okay, but mark the date of yours. It will be easier for you to do your count from month to month. And now speaking about you, as I mentioned, you're with the hormones up there. You're almost at the peak of HCG production. When it comes in 12 weeks that it plummets, and most of the symptoms we have now end up disappearing. In fact, we will have more disposition later on. Disposition is nothing close to what you are feeling. You feel unwell, you feel tired, you feel sleepy, you have nausea, you have heartburn, you have reflux. Wow, how much stuff, huh, mom? It's not easy. But we do have some tips to improve. All of this that you're feeling happens because of the HCG that's increased, your progesterone that's increased. It also has a hormone called relaxin, which is to make joints more relaxed, to accommodate the baby, right? For belly to grow, hips to increase, but it ends up relaxing the whole body, which reduces the peristaltic movement that the bowel movement makes to take the cake down there. And that constipation can give you hemorrhoids. Oh my God, calm down, let's avoid all this. So the first part is if you are having heartburn, poor digestion or reflux, avoid liquids during meals and try to make meals lighter, avoiding frying, pasta too, very heavy sauces. All of this ends up doing your food stays there for a long time in your stomach, also increasing the production of that gastric fluid and increasing heartburn, increasing all of that. And if you go to dinner hours before going to sleep because you ate and lay down, you can be sure that heartburn reflux will eventually appear, right? Then you have to be careful with that. And since I talked about lying down, I'm going to try another important tip, okay? Try to always sleep on your left side, down in bed. Why is that? We have a vein that yours is not yet being pressed, but it's good for you to start the training it does. An important part of our circulation is called vena cava. When we are pregnant and we sleep or on our stomach or on our back or on our right side, we kind of crush this vein a little bit. When we stay on the left side, it becomes freer, more fluid to be able to make the exchange, right? Of blood throughout our body, decreases our swelling, increases our oxygenation. So in addition to this benefit of having this bald V released, our stomach, it doesn't stay like this in our body, it stays like this. So when we lie on the left side, our stomach, it will lie flat. Do you understand? It won't stay at the same height as we are, it will stay down, which will decrease the reflux and also your heartburn. Then you can start training on the left side. Then you tell me, Monica, I can't, or if I didn't lie on my left side, I woke up from upside down, I'm going to hurt, oh, but no, it won't. Is that it's much better if you stay on the left side, but if you can't or woke up another way, it's okay, all right? You're not going to be desperate, but whenever you're awake or on the sofa, try to stay on the left side, which will improve not only your circulation, but oxygenation, and also the exchange there with your baby. It's worth it, okay? It's so worth it in the heartburn part, it's liberating. I continue to sleep on my left side to this day since my pregnancy because of this. And as I'm already talking in Asia, some more citrus things can get worse, okay? For example, tomato sauce, wheat, bread. This makes heartburn a little worse. Some medications can be taken during pregnancy, but only with the indication of your obstetrician, so talk to your doctor. If you are suffering from heartburn with reflux, he can medicate you so that you have well-being during pregnancy. Pregnancy is not for us to suffer, okay? Pregnancy is for us to enjoy as much as we can. You may also already be feeling that your veins are bluer, more apparent, right? We will feel it more in our breasts. Here in the courses, we can also see in the legs. Speaking of leg, the leg is swelling, the foot is already getting a bun. Whenever you can, when you're sitting on your couch or lying on your bed, put a support under there of your feet so that they get a little taller and stimulate more circulation. That'll help too, okay? I know, they stay, right? More prominent, more pointed out because of the circulation of irrigation it is having. But hey, warn your partner there that you can't play, because he gets more sensitive too. We often feel pain. If that's not your case, everything is fine. But if colostrum has started to come out, it's still early for some women. Others won't even notice it. But the exam that the obstetrician will do, he will notice it's not to stimulate, okay? It's not to stimulate the output of colostrum. No, you have to take it easy, please. And the last thing I have to say about you is that nasal congestion and nosebleeds are very, very common during pregnancy, especially when we are at a dry temperature. It's not even a question of heat or cold, it's dry. The dry environment makes our analyst even more congested and bleeding. Try to make the environment more humid. He can help you. It can be with a humidifier, it can be with a wetter towel, right? Close to you, near the head of the bed. This can help you and bring a little more comfort. Solving it doesn't solve it, but it helps a lot, okay? And now, let's talk about your little baby. Your little baby is already the size of a green olive, not that big black green olive, okay? It is already measuring between 2 centimeters and 2.8 centimeters, weighing around 4G, and is the tastiest olive on this planet. Oh, what a desire for that olive. Of course, this measurement is made from head to butt. We are not including the legs because they are still in formation, and in the second quarter, they will all be doubled. It becomes more difficult for us to make this measurement, so it's from the head. On the butt, he's an olive grower. In this 9th week too, he has already started to move. Remember what I said last week? And it's all because of the joints. The wrists, shoulders, knees are all forming there, and we can already see all this movement on the ultrasound. And you know what else you can see on the ultrasound? Cute little fingers. His little head is still pretty big compared to his body. The little neck is already emerging, which is making him stay less with this position in itself, and raising more his eyes that were further apart, are going more and more forward of the head, his even more formed feature. Even the eyelids are already formed, already closed, so that your little eyes can mature inside. Oh, how cute, you can follow it. Support all this for this image that I'm leaving here for you, next to the ultrasound. Now you can hear the heartbeat. You could already see since 6 weeks and 3 days, but now you can already hear too. And by the time you hear it, I bet your heart will beat faster than his, because his heart beats so fast. But our emotions don't let us restrain ourselves. It's exciting to hear these little beats. Their little ears are getting louder and louder. More complete and capricious formations. Talk, put on songs you like, sing music, read the story, participate, and call dad to participate together. I always say this to you, it's more real to us, the gestation. We are feeling all that, so we have to bring our partner to follow along with us. We invite you to watch the videos of the Parents Almanac here together with you, so you can follow everything that is happening with this little baby, stay up to date with what's happening, and participate. It will be more enjoyable for him. He is also immersed in this world of pregnancy, which is delicious, full of discoveries. A curiosity is a spoiler here. The eyes of babies, usually they will be born with blue eyes, gray, hands even brown. But the eye itself, it will look its final color between 6 and 9 months. Some children until a little later. Lucas, for example, he had dark blue eyes, gray, until he was a year old. Only after that it became a color a little more. It's more for honey, but he had this variation a little late. Okay, so it's not because at about 9 months you celebrate a blue eye, not yet, but don't worry, you still have time to get there. The intestines begin to form there in the umbilical cord, and they will now begin to migrate into the baby's abdomen. About the sex of your baby, back in the 7th week, I told you that training began, right? Testes or ovaries to find out the sex of the baby. But now this week, in the 9th week, the formation of the sexual organs will begin, right? Or the external genitals. But we can't see it yet, but we can already know. You can find out through a test called fecal sexing, which you have on the private network. It's not public, okay? It's a blood test that will see if there is a boy chromosome circulating in the mother's blood. So if it is a boy, it is a boy. If it is a girl. You mean she doesn't have a boy, right? A girl like her mother, so it will be a girl. You can also wait until next week to take the NAS test from Hagenomics, also from the private network, which in addition to knowing the sex of the baby, you know the risk for chromosomal diseases. I'll leave a full video about this test here, or you can wait up to 16 weeks to find out through ultrasound, okay? Some mothers will only do it at 18 weeks, which is what the laboratory releases, or in the morphological 2nd trimester at 20 weeks. My feeding tip for this week is to continue drinking plenty of liquid. Remember that soda doesn't count, okay? When we talk about 2 liters of water, we don't include soda in the bill. He drank soda on his own. He doesn't go in there because he's not healthy for you, okay? So continue drinking plenty of liquid, but avoid taking liquid during meals to decrease exactly the ASIA and reflux are so recurrent also in view of the fibers. They help increase the fecal cake. Remember I said the peristaltic movement was slow? The fiber increases the fecal cake, so even this slow movement, it will manage to propel the poop to come out clear. So which one ingests a lot of fiber, like enough fiber to increase your fecal cake, so you will be able to make more poop and reduce, including hemorrhoids? Because in the case of being stuck for a long time, the longer the feces stay there in the intestine, the more liquid we take out of them, the drier they get. So it's important that you invest enough liquid so you don't stop, right? For your entire body to function right, including the gut river, the skin, everything, and also the fibers. All of this will help your intestines work much better. And now let's go to the tip of the week, the first tip I need. I'm going to tell you that yes, there is an obstetrician who is the obstetrician that we need to consult to monitor our entire prenatal period, and you are already following up, right? The Parents' Almanac is not a substitute for any exam. I'm here to give you information, to give you welcome, to give you tips, but it doesn't replace a medical appointment. You have to go to your doctor, but in some cases they can refer you to an obstetric nurse or an obstetrician to be able to carry out this monitoring, okay? They are also trained, they too. They can carry out these follow-ups as long as it is not a high-risk pregnancy. Whenever there is any complication, it has to be indicated then to the obstetrician. The difference is the obstetrician trained in medicine. The obstetric nurse is a graduate in nursing with a postgraduate degree with a specialization in obstetrics. And obstetrics is a health professional who is certified to be able to do this obstetric service as well. However, they cannot monitor high-risk pregnancies, but they can monitor their entire pregnancy, including childbirth and even home care. If this is your case, they can do this follow-up, and if there are any complications, indicate to you for you to seek a doctor. Then there is the doula. A doula does not replace the services of any of these health professionals. The doula, she is much more of a support for women, an important psychological, emotional support. It's wonderful. If you can have a doula and you can already start talking with it, is either investigate or talk to meet doulas already. They can monitor your pregnancy now, or you can wait until later. So this information is important for you to start doing your research for professionals. I've already told you that whether or not you have medical insurance, you already need to know within your city where you can be served. Start researching hospitals and already know which ones have obstetric care. Because if you have an emergency, an infection, a bleeding, you're going to have to go to a hospital that has obstetric care. If not, you will not be well served. I mean, it could, but maybe some are missing. It's some assertive guidance, including to solve your case. So please already make a list of which hospitals you can turn to, whether for childbirth or also for some emergency, or for some doubt or even consultation that you need to make. And my last tip is about your evenings. Are you having a lot of sleep or insomnia at night? If you're having insomnia, see if you are not taking too much nap in the afternoon or if you are too anxious. Anxiety makes our head get so agitated, thinking about so many things that we end up not relaxing. And what do? We get information. Information is our best friend, so we can even take care of anxiety. So if you have questions about your pregnancy, write on the paper. When you go to your appointment with the obstetrician, already take these questions with your obstetrician, talk to him. If you have doubts, for example, about your job, talk to HR, talk to your contractor so you can see how it will turn out. In fact, if you are a citizen company, your maternity leave instead of 4 months can be 6 months. I'll let you negotiate, right? Calm with your contractor. So go get this information so you know what the next steps are about developing it. Your baby's movement, about what's happening in your belly, in your body, how it's with the parent's almanac, that I am producing this content for you in a renewed way with the latest news. I am the creator of this board, so you can rest assured that there is a lot of quality information and health professionals who accompany me to bring incredible information to you. I hope you enjoyed this video, that you are doing very well this week. Leave a like here for me, share with a pregnant woman. See you in the next video.